I'm Luciano Costa. I'm a myeloma physician at University of Alabama Birmingham. I'm here at the ASH meeting in San Diego 2024. And at this meeting, the consortium that we're part of, the COMIT consortium, is bringing some data on what we call the Commander trial. My colleague, Dr. Natalie Callender, is presenting that as a poster. So the Commander trial, the premise of that is, as we know, MRD positivity is an indicator of worse prognosis in multiple myeloma. And nowadays, most patients will achieve MRD negativity after induction therapy and transplant. But what about those who do not? And this trial was meant specifically to try to reverse or to induce MRD negativity and maintain MRD negativity in patients who are MRD positive after transplant using Iberdomide, which is a CELMoD. So for those who are not familiar, CELMoDs or cereblon modulators are oral drugs, very much like Revlimid or Pomalyst, but they're kind of a 2 generations up in the sense of being more, doing better what Revlimid and Pomalyst does, perhaps with less toxicity. So this trial initially combined Iberdomide with daratumumab and dexamethasone for 6 cycles on patients who are MRD positive after transplant. And after 6 cycles, they go to Iberdomide single-agent maintenance. And then, because this was done and was done safely, we tested out different doses without any problems. Then we opened the second cohort, which is Iberdomide carfilzomib, so now deploying the most active proteasome inhibitor we have in combination with Iber and Dara and dexamethasone to try to make those patients MRD negative. She's presenting the results of the Part A, which is the dose finding. And the good news is all doses that we tested all the way to 1.6 milligram of Iberdomide were well tolerated. Because Iberdomide is being developed further at the 1 milligram dose, so that's the dose we're sticking to for the Part 2. And the good news is the drug was well tolerated. Near half the patients on Iber-Dara-Dex converted to MRD negativity. Remember, many of those patients have received prior Dara before. So despite that, we're able to convert patients negative. And so far, every single patient on the quadruple therapy, most of which have received quadruple induction and are MRD positive after transplant, were able to convert to MRD negativity with Iber, carfilzomib, Dara-Dex. So I think it's the first time we're seeing safety data for this very important combination. And I think that can be extrapolated to other settings of myeloma. That is a safe quadrupled regimen. But most important, it gives options in the future for patients who receive the best upfront therapy with quadruple, receive a transplant, and still have a stubborn disease that need to be dealt with. Use a regimen that is well tolerated and perhaps can lead to a deeper and longer lasting response.